ambulance service. Is the patient breathing?
My name's Kim, I'm on the ambulance crew, all right?
This is the Scottish Ambulance Service.
We genuinely get to make a difference in people's lives.
The job literally is life and death.
No needles or anything on them, though. There's nothing I would rather do than this.
Serving every one of us.
It's okay, love. It's all right, don't worry.
From Scotland's busiest cities to its wide open countryside. Wherever we have fallen, whatever has happened to us.
Need a hug?
Just scared she's gonna die.
But this is a service under extreme pressure.
We're constantly apologising to people.
Yeah, it's very busy down here.
Which we rely on like never before.
We're 2 shifts down in Edinburgh and 3 in the Borders.
Here we go, here we go, here we go.
On the front line and at the other end of the line.
1, 2, 3, 4.
Scotland's paramedics keep Scotland safe
Breathe the gas.
and alive.
Help is coming, they're coming as fast as they can.
This time,
You squeeze my hand for me, Liz.
crew treat a patient who's struggling to breathe. And 2 patients with suspected broken ribs. One who's fallen off a motorbike.
Is that sore when I push on it? Yeah. Right, just there.
And one who's had a very different kind of fall.
It's slightly unusual for a 71-year-old to be injured in a trampoline accident, I guess.
Thurso, the most northerly town in mainland Scotland. Over 7,000 people live here, surrounded by miles of rugged coast and unique peatland bogs. Covering this beat today is paramedic Gordon and technician Gavin.
Just don't know what you're going to get up here. It could be anything, it could be anywhere.
No 2 days the same. We could be down a farm track one day, we could be in the town, we could be in our nearest city, which is over 100 miles away.
Saving lives in this part of the world does come with its challenges.
We cover quite a large geographical area here. We don't have several large hospitals within an hour's travel of us.
I wouldn't say we're doing more, it's just we maybe have to plan it a bit more.
Each year, thousands of motorists and bikers flock to this part of Scotland to ride the popular North Coast 500 route. And today, one of these riders has called the paramedics for help.
Right, it says we've got a 59-year-old male, name unknown as yet, unable to move due to severe pain, came off his bike yesterday.
Okay.
Sore ribs and chest area.
999, activate.
With the North Coast 500, we do get a lot of bikes, a lot of holidaymakers coming through. The information was quite vague. It was a traumatic incident involving a bicycle or a motorbike. It looks like it's the way in, car park in the way in. Right, we've got a name now. He's now 60 years old.
Okay.
He's aged in the 5 minutes it's taken us to come out to him.
Yeah.
Came off bike yesterday, ribs and chest area, also having spasms. Chest hurts when he speaks.
So it could be an injury from yesterday then.
Yeah.
By chance, yeah.
Well, I wonder, well, we'll soon find out what happened yesterday, won't we? Right, we're not far off now. He's not pushing his bike to meet us now, is he?
I hope not.
Ah, there's a whole load of bikers.
Yeah.
Right.
Cancelling main function.
Excuse
He can't hardly move. Is it yourself we're here to see?
I think the handlebar, I mean, they don't, he can't do anything, okay? Yeah!
All right, okay. I could see the gentleman was in distress. His body language, he was tensed. I could see he was guarding his chest. His face kind of looked pale. What to do is, are you able to hold on there to balance yourself?
He can't do that, that hurts as well.
That hurts as well. He'd come off his bike the day before and he was struggling to breathe. He felt he was struggling to breathe and he was very painful and having spasms in his chest. So say, just try and calm your breathing down. Now the plan is to get you in the ambulance by hook or by crook.
Don't make me laugh, please don't make me laugh.
Right, I mean pain-wise, as I say, how bad is it?
For 935,000 million.
A lot of people, when they have injuries or incidents like that, the tendency can be to try and just shake it off, get on with it. But usually if, say for example, 24 hours later, there is still a problem or an issue, I think usually then that can point to something a bit more serious.
The crew urgently need to get Andrew into the ambulance for assessment.
Okay, just nice and gentle. Perfect. Did you lose consciousness yesterday when you came off the bike? No. Okay, so I'm going to need to take off the jacket. As I say, I'll try and be as gentle as I can.
Okay.
The other option is we could cut it off if you want.
That's what they said.
Yeah, it's okay for them to have a sense of humour. You're the one that's in pain.
Oh, I am.
Yeah.
And I've been doing it on purpose to try and make me laugh as well. Because you know that. Yeah.
Right. I know with friends like that, who needs enemies, eh? Can your arms go up like that?
If I did.
I'm just thinking I could lift your jumper straight over your head, if that's okay. Hands closer together. That's it. Right.
I used to suffer with a spasm in the back.
Right, so yeah, like that.
Oh, get it on.
Right, has that passed? For now, okay. Can I lift the t-shirt? Is it okay if I have a look?
In order to identify Andrew's injury, Gordon must work out the nature of his accident.
So you think the handlebars hit the side of your chest here?
Somewhere there, yeah.
Right. Okay.
Because that's where I'm having a spasm.
Right. So what I'm looking for is some bruising, which I'm not seeing any at all on the front. No bruising at the back.
Oh, sorry.
Okay. There's no open wounds or anything like that.
No. It was 10 miles an hour.
Right.
You dropped onto it. Grass.
No, but you can still do a fair bit of damage, even if it's 2 miles, you know. If there's a breathing problem or an issue with breathing, obviously that affects your respiratory system. So you want to think about the mechanics of what the problem is. Okay. And that in conjunction with a traumatic incident, you're looking at possibly a broken rib. Worst case scenario, it could extend to a punctured lung. I'm going to have a wee listen to your chest, and Gavin's just going to get a set of obs for me, you know, your blood pressure, oxygen level, heart rate, that kind of thing. I just want to press slightly on your chest. Will you let me know where it hurts the worst?
Let's come on again. Ah. Good. Ah.
Right, I'm going round this side now. Is that sore when I push on it?
Yeah. Ah.
Right, just there.
Just there.
Okay. Right. Would you say the pain is there constantly, intermittent?
The pain's there all the time, yeah.
Right, okay. Yeah. When I lightly pressed on just underneath sort of mid-axilla region on the left-hand side there, you obviously jumped a little bit, so it's hard to tell. You might have a broken rib there. But either way, I think the best thing to do is we'll need to get you through to the hospital and get you checked.
This is supposed to be making me better. This run.
Right. I'm sure it would have if you never came off your bike. Yeah. Given his obvious pain that he was in, he was still quite upbeat, quite chatty, quite jovial.
It'll go a long ride home. Where are you from?
South Yorkshire, Doncaster.
Ah, right, yeah.
Right.
Actually, did you know Doncaster is still part of Scotland?
Is it?
Yeah,
Oh,
still
right.
owned by it. I never knew. They only found out that he...
What other medication did you say you're on?
Metformin.
Because it sounds like you're having hallucinations now as well.
No, it's true.
Before the journey to the hospital, Gordon needs to administer some pain relief.
If you can get your bum slightly up towards this end, that's it. Don't worry about your boots. Just pop your legs up.
But the normal method of gas and air isn't going to work for Andrew.
In order to get good use of the gas and air, you need to take good deep breaths in. Now, he was already guarding with his chest because it was painful to move. So to try and get him to take deep breaths in, I felt was actually going to exacerbate his condition.
I can...
Yeah, that's making it work.
Right, I can... Let's try and sit up again for me. Right.
As his friends carry on without him, Andrew is going to need something stronger for the pain.
Right, I'm going to try and go for some morphine, Gav. Hopefully you're okay with needles.
At the ambulance control centre in South Queensferry.
Ambulance emergency, is the patient breathing? Is he awake?
Sarah is involved in one of the most critical calls a call handler can take. CPR.
1, 2, 3, 4. 1, 2, 3, 4. From the start of the call to compressions, it's only a matter of maybe 30, 40 seconds, and you should have them on the floor starting chest compressions. We say it's hands on chest as quickly as you can. The quicker that you start doing it, the better chance the person has. If they're on a chair or a bed, we have instructions on how to get them off the chair or bed onto the floor, and then after that it is just straight into chest compressions as soon as they're flat on their back on the floor. Is somebody keeping an eye out for the ambulance crew? Right, okay, perfect. Just let me know when they're there. Just get that lady to keep going with them just now. So our first instruction is to place the heel of your hand on the breastbone in the centre of the chest, right between the nipples, and the other hand on top of that hand. We then speak them through, pump the chest hard and fast, at least twice per second and 2 inches deep. If there's multiple people on scene, we do advise that they can switch over between people. If they do switch, we read the instructions again to make sure everyone's got a full set of instructions. And then from there, we just start counting them through the rate.
There are other people near this caller, so the task of CPR can be shared.
Right, okay, if they're changing over, that's fine. Just try and make it quite quick. And just make sure the other person's heel, the hand's on the breastbone, right between the nipples, and the other hand on top of that hand. And again, they're going to push down hard and make sure the chest comes all the way up between pumps, okay? And they're still going at that rate. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
Despite call handlers giving calm and simple instructions, CPR is physically demanding.
It's hard even doing it for 2 minutes. You can hear it in people's voices on the phone that they get tired so quickly, but it's just all about encouraging them to keep going, because that's what's going to give the patient the best chance. That's it, just make sure they're pushing down hard, okay? People do get worried about hurting them, especially if people are older and frailer and quite thin, but we just advise them still to push down hard, because that's what's most effective. Even if it does seem like you're hurting them, you probably aren't, because they don't know any different at that time. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
During this call, the people helping find out the patient has a do not attempt CPR order in place.
We do check if they want to do chest compression. Some people do. If not, they usually say it's against the patient's wishes, they don't want to, so they can choose to stop. Do you want to carry on with it, or? Yeah. Right, just keep going with those chest compressions then, okay?
Because they have already started CPR, the callers decide to continue.
When the ambulance crew comes in, if you're keeping going with that CPR, just keep going with it until they're in, okay? 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
Sarah must keep in contact with the caller until the paramedics arrive.
1, 2, 3, 4. 1, 2, 3, 4. They should be arriving outside just now. Just let me know when they're coming in, okay? Are they still going with them just now? The ambulance is there. Right, that's fine. I'll let you go if they're there, okay? Perfect. Thanks for your help. Bye-bye. CPR is stressful, but sometimes it's the most simple call you'll get. Really, when you're in it, your adrenaline's that high that you just start it. All you need to get is the address, what's happened, and you're straight into chest compressions.
In Thurso, Andrew is suffering severe pains in his chest after falling off his motorbike.
Is that sore when I push on it? Right, just there.
Just there.
Okay.
Unable to use gas and air for pain relief, paramedic Gordon is administering morphine.
Any nausea, any vomiting that you felt prior to us arriving or now?
No.
Nothing?
When I got here, I was just sick, but I got it in my mouth.
Right.
I was pretty down to the pain.
We're going to go some ondansetron as well.
Okay.
Okay. I'll give you something to counteract that sickness as well.
How's your pain now? Any better?
I'm still waiting for it to kick in.
Right, okay.
Still fairly there.
Yeah.
But it's, I don't think it's...
Yeah, you're speaking better anyway. You can...
Yeah.
I can actually see a bit of colour coming back to your face now as well.
Going to the morphine, that not only helped with the pain, but it also helped him to relax so that he wasn't guarding as much, so that he could then take deeper breaths, get more oxygen, which would then help with his perfusion and help with his condition.
But Andrew's not completely in the clear yet.
The beauty of this pain relief is it'll make you feel as if you don't have any issues. But again, if you do move, you could exacerbate something. So still be nice and gentle with your movements. Now, you'll be aware of the roads in Caithness with potholes and things like that. Gavin's going to go as gentle as he can, but there might be a bit of bumping, so hopefully what I've given you for that pain will help as well. Okay, right, cheers, Gavin.
Gavin sets off on the journey to Caithness General Hospital. Slowly.
I'm a bit of a speed freak, you see, so that makes it even more funny.
The fact that you fell off it, yeah.
I said, if you'd been going faster, you wouldn't have been here, would you? I probably lost just past the head test, and I said to them, don't use your front brake when it's slippery. What did I do?
Yeah.
Front brake, that's where it flicked, twisted, but it gave such a whack with handlebar. That's what chucked us over.
But if somebody is in a talkative mood, then engage with them, takes their mind off the initial incident as to why you're there. It makes the journey to hospital a lot quicker.
You can be honest and say it is the driving if you need to.
Not fast enough.
So judging where we are, we're about 10 minutes from the hospital. What I'm going to do is I'm going to give you a little bit more of this now, just to tick you over again. What we need to decide now is how we're going to get you into the hospital. I can take you in on the bed, if we can get you on the bed. We can get you a chair, if it'll be easier. Or if it's just easier for you to walk, we can get you to walk in. Obviously, my preference would be for us to at least get you a chair, in case the spasm kind of makes you drop or fall again.
Andrew arrives at A&E, a journey that began on a Yamaha in Yorkshire, ends in a wheelchair in Wick.
More morphine. That didn't last very long, did it? It's just because I moved.
Right, yeah. There you go then. Sorted. Right, okay. You just set off a couple of bumps till we'll get you over the threshold, but then it's smooth. A wee bump here.
Dalkeith in Midlothian. Paramedics based here handle over 500 incidents every month, from Edinburgh to the borders. And like every other station across Scotland, crews are expected to go wherever the job demands. 999 Staying local for now, paramedic Scott and ambulance technician Kim are responding to a call in town.
Okay, so we're going to a 63-year-old female. It's reported she's conscious and breathing. The notes say female collapsed, speech problems and not responding, and that's all we have.
The patient's symptoms could mean she's suffered a stroke.
Speed bump. It's an absolute nightmare, like, to drive an ambulance through because you've got cars parked at both sides of the road.
The next year, Kim will be under the watchful eye of Scott as she trains to be a fully fledged paramedic.
I don't think my parents were surprised when I told them this was going to be my career. It's something that I've always sort of dreamed about doing. Oh, I never realised to put speed bumps on this road.
Shit. So did you pick the speed bump road?
While Kim is at the start of her career, Scott has spent much of his working life in this field.
I've always worked in healthcare. I've worked 23 years in healthcare. It's been about the patient. That's what my role's always been.
I've been here before.
Oh, yeah.
Yeah. I feel like I have anyway.
The crew find the patient, Annie, very unwell.
Hi.
Hello, sweetheart.
I spoke to her, must be a couple hours ago.
Okay.
And then I phoned my dad to ask a question. He's like, oh, your mum's fallen.
2 o'clock, Shashi.
2 o'clock.
Yeah.
And where did she fall? Just like this?
No, she was outside.
She was going to get in the car.
The neighbour along the road had seen her fall.
Right.
So they came all along, they were getting her on her feet when I...
Annie, are you able to open your eyes? Are you able to do that for me? Open your eyes up wide. Well done. Can you squeeze both my hands? Can you do that for me?
So initially the lady did present like she was having a stroke. She was unable to verbalise, she was unable to move her limbs or obey commands. So when we get a call about a stroke, like any emergency, it's time critical, but strokes really focused on time. So we want to catch a stroke within a hyperacute window, which is 4.5 hours.
Try and pop your jacket off, darling. Do you mind if I cut this jacket? It's just she's quite unwell just now.
The crew run through a national early warning score, known as NEWS. This is a guide used by medical services to assess how ill a patient is.
We basically take all your observations and they get entered into the tablet and they generate a NEWS score. Obviously, the higher the score, the more concern we have.
I'm going to get a wee scratch from your finger there, and it's just to check your sugar.
She has been on NSP recently because she's been having urine infections.
Okay.
That they've not been able to get under control.
Yeah, blood sugar was fine.
Yeah, was it, did you say 9.0?
9.0, yeah.
So that's came in at 86.
Blood oxygen saturation levels between 95 and 100% are normal. But at only 86%, Annie's levels are low.
She's obeying commands, but...
She's trying, she's just...
Yeah. So she was totally trying to open her eyes there.
39.
Right, 39 before.
Quickly established that she had an extremely high temperature. So that points you more down the infection route, but it's not totally unheard of for a patient to have an infection and to have a stroke.
And did she bang her head or anything, sir, when she fell?
Well, as I said, I didn't hear because I was at the back.
I did ask her, like, Mum, did you bash your face? Did you bang your head? She says no.
Did you say she was sick?
She has been sick, you can smell it on her. So I've seen on her top as well.
Yeah, see there. We're sort of trying to deal with the possibility of a head injury and trauma, as well as patient vomiting and having signs of an infection as well. So there was quite a lot going on at that job.
A lot to think about,
Annie needs to get to hospital immediately. The crew don't know if they're dealing with a stroke or a reaction to an infection, but both can be life-threatening.
Ambulance emergency, is the patient breathing? Is the patient awake?
In the ambulance control centre, Sarah is dealing with a familiar call, a drug overdose.
Okay, tell me exactly what's happened.
But this time, 2 people have overdosed together.
Are they both overdosed? Okay. Okay. Are you there with them just now? Okay. And are they both unconscious? Okay. And are they both breathing? Yeah.
Sarah has to work out how to monitor both patients at the same time.
So I'm going to give you some instructions. I need you to do this to both of them, okay? But I'll give you the instructions for them, all right? So listen carefully, lay them both flat on their back and remove anything under their heads and let me know when you've done that for both. Okay, perfect. So again, we need to do this for both of them. I need you to place one hand on their forehead, your other hand under their neck, and then tilt the head back. And again, let me know when you've done that for both. Right. Having 2 patients makes it a lot harder if they're both unconscious because you have to get them both flat on their back, both tilt their head, and then check both their breathings. So we're going to have to do this one at a time, obviously, because there's 2 patients, okay? So whatever one you want to start with, that's fine. And I want you to tell me closely, I want you to watch them closely and tell me each time one of their chest rises, okay? Yep, so every time their chest rises, I just need you to say the word now for me, okay? You ready to do that? Okay, so start now. Next one. Next one. And the last one. Okay, that's fine, perfect. Now, are you able to go over to the other person and do that as well? Next one. Next one. And the last one. Okay, perfect, thank you. And if they do vomit, turn them on their side and clean out their mouth and nose. I'll stay on the line until help arrives, okay? Just let me know when they're there or if anything else changes.
As well as instructing the caller, Sarah is inputting information which a dispatcher will forward on to the crew.
And does anybody there have any idea what they've taken? Okay, what is it you think that they've taken? Street Valium. Right, okay.
Street Valium is unpredictable and dangerous. Users often don't realise what the drug they are taking actually contains.
Is that them there? Right, I'll leave you with them then, okay? Take care. Bye now. Street Valium's the biggest one. But now anyway. You hear about it all the time, especially at the weekends and night time and things. And the scary thing is, you don't know what's in it. You don't know what it's like cut with or what's in it, or that's the problem. There could be anything in it. Especially things like fentanyl and things like that. Like, there could be anything like that in it, and that's stronger than heroin. That scares me.
In Dalkeith, Scott and Kim are attending to a seriously ill patient. It's unclear if Annie has had a stroke or is suffering a severe reaction to a urine infection.
Right, Annie, we're going to get you moving up to the hospital, okay? We'll lift you up over onto this chair as best we can.
It's going to be a bit tricky, I think.
Do you think you could help me by sitting forward? Are you able to do that?
That's it. So we've got a seat here.
That's it. You stand up with me. Perfect.
yeah.
Well done. You're okay.
Amazing. That's you. And it's going to be a bit bumpy going down these stairs.
You okay? Can you open your eyes? Nice and wide? Okay.
If Annie's illness is related to her urine infection, it could mean she has sepsis.
So sepsis is basically an infection affecting your whole body, so it's a total systemic infection that you've got, which, if left untreated, is life-threatening.
I'm just going to look at putting a cannula in your arm, okay? Sharp scratch.
Sepsis is rare, but with lots of possible symptoms, it can be very hard to spot.
Any sort of infection can lead to sepsis if it's not treated initially. The more sort of severe patients that we see have got a high temperature,
Increased respiratory, increased heart rate.
Yeah, followed by the possibility of having rigours or confusion as well.
We'll just go for IV paracetamol as well, since she's no. There's going to be a risky choke anyway. Tablets.
While Kim collects Annie's husband, Scott checks her pupil's reflex response.
What's this there? So you just have a wee seat there.
Kim, you need to check pupils again. So I found an abnormality, I think.
As part of her training, Scott asked Kim to examine how Annie's pupils react to light.
You seen the right one's bigger?
So I was finding left one was slower to react, yeah, so.
Right one's definitely bigger as well.
Enlarged pupil size can be normal for some patients, but it may suggest a head injury or stroke.
There's a couple of things going on. So she would be currently classified as fast positive, which is a sign of having a stroke, but she's also got an infection as well underlying. So it could be that this is all related just to the infection. How long for you here, Kim?
We're probably about 12 minutes.
12 minutes, okay. Hi, Dalkeith, 3715, just to pass a medical standby, please. Temperature of 39.4. She is fast positive. Our ETA is 12 minutes over. That's us just pulling in, Annie. 2 minutes. Okay? And you've arrived. I'd be really interested to find out what's actually going on with her.
Yeah, so it was like query sepsis, query stroke. She was quite unwell, whatever was going on with her.
Banff, on the north coast of Aberdeenshire. Paramedics based here can attend calls anywhere in the Grampian region. And with the majority of patients being taken to hospital in either Elgin or Aberdeen, crews can clock up over 300 miles on a single shift.
At Banff, we're definitely quite a rural station. We are 42 miles from Aberdeen, which would be our kind of nearest A&E hospital.
We are that little bit further away from the hospital, so that when someone is sick and they're in the back, you really have to do something. And yeah, you'll get backup, you'll get the support, but you will have to wait for it. It's not just round the corner like what it may be in a city environment.
Trainee paramedic Josh has always known that this was the job for him.
I guess you just always want to help people and just be that friendly face in people's time of need, and being able to make that difference, it's a feeling that you can't really describe.
But for paramedic Lisa, this wasn't always her first career choice.
This isn't something that I always thought I would do. I was probably just a wee bit, didn't really know what I wanted to do, and I just saw an ambulance one day and thought, that might be quite good. And 7 years later, here we are.
Because the fire service didn't take you.
Yeah, can't be a fairy.
It's 5 a.m. and the crew are at the end of a night shift.
Thank you for mobilising towards this incident. At the moment, you are going to back up your colleagues on the Fraserburgh vehicle. They're just arriving on scene. Now, the captain advised that CPR has begun. We will keep you updated as best we can. Over.
Roger, that's all received. Many thanks. So we're off to a 71-year-old female who initially was a first-party caller for ineffective breathing, but now confirmed cardiac arrest, CPR ongoing.
I think the patient had actually phoned herself, quite short of breath. She's been talking to the call handler initially, and then she stopped talking. So at that point, we don't know what's happening.
We're backing up our Fraserburgh crew in Fraserburgh, so we're a little bit away, but we'll see what like when we get there.
As a backup crew, you're expecting to go in and probably relieve whoever's doing CPR if they've been doing it for a wee while.
Fraserburgh is a 25-mile drive away.
I always think it's such a horrible road.
It's like pea soup. It's such a bumpy road. It's not bad if you're driving normally, but I think on blue lights it's just so bumpy and windy.
When you're on your way to a job coded as a cardiac arrest, at that point, yeah, the adrenaline's going.
Extreme caution. Cab door open.
Which one is it? Hello? What's this lady's name? Is it Elizabeth? Liz.
When we walked into that house, you were definitely worried about Liz. The fact that she was unconscious with a breathing problem is quite serious.
She was just couched in here in a bundle, and this is why we found her. She's fair chan doing, so we've got an MPA in.
Good.
Got oxygen on, and just about to see about getting access.
Is it IO you're going?
Sorry?
Are you going IO, are you?
Well, I could go IO or IO.
Do you mind if I have a go? I'm practicing part 2, is that okay?
I kind of took a step back at that job. We had Colleen on scene, who is a competent paramedic, and then Josh himself is a trainee paramedic. You don't all need to be with the patient. I'll get things going for getting her moving, because she's definitely going to be going to hospital and we need to be getting there as fast as we can. It's definitely a time critical situation.
In order to treat Liz effectively, Josh and Colleen need to figure out what happened to her.
Any past medical history?
COPD, and she's been struggling with a chest infection.
COPD is a chronic lung condition. It can flare up suddenly, causing extreme breathlessness.
Here we've got an MP and we're waiting, so we can't get an OP or anything else in. So an MP is in. 150 metres, got access.
Respirator adequate.
Rests are more than adequate.
Right, listening, I'll help.
Blood pressure.
Slightly tachycardic.
Yes.
SpO2 is okay.
Yeah, quick look at the chest.
The only history we know is COPD.
COPD, chest infection.
She was quite hypoxic and cyanosed around her lips and things, so it certainly looked like a respiratory problem that we were dealing with. Sorry, my dear, that's your arm. There's a wee needle in the back of your arm, so we'll try and keep your arm nice and straight. Okay, my dear. Essentially, we ascertained it was likely an exacerbation of our COPD, a severe exacerbation of our COPD. So we started treating it as such with things like salbutamol and Atrovent, which are bronchodilators and things that help to open up her airways so she can get more oxygen in and out.
Liz, that's it. I'm Colleen, we're just getting something sorted.
Want to pass the scoop over?
We'll get you to hospital. You squeeze my hand for me, Liz.
With Liz struggling to breathe independently and the hospital over 40 miles away, the crew need to get her to the ambulance as quickly as possible. In Dundee, veteran paramedic Fergie is on shift with Chloe.
Unknown.
This is chest pain, but it's a fall. So we hurt her ribs 2 days ago.
It's great working with Fergie when I'm training because he's a mentor and he's pretty much taught me quite a lot.
Today, the crew have been called to a flat in the west end of the city.
Aye, okay.
We learn things from each other.
Yeah,
you know,
it's been good.
Because I've got a bit of experience in this job, but also a lot of the actual academic things that I learned years ago, I've forgotten the actual details of them because I don't use it on a day-to-day basis. So that's when Chloe comes back to help me with her up-to-date scientific knowledge.
Fresh out of school.
Fresh out of school. Knows what we're meant to be doing.
Okay, so we are going to a 71-year-old female with chest pain. She fell 2 days ago and she's got a pain in her right-hand side ribs, and in her shoulder and in her arm. She's conscious and breathing. C'est magnifique. Hello, ambulance. How are you doing? What's your name?
Hazel.
April.
Hazel.
Hazel, apologies. Sorry, Hazel. Right, you're looking a bit distressed. What's happened to you?
2 days ago, I had a fall and it's been painful.
I can see you've got quite a bit
Ribs
of pain
have been
there.
painful, but today it's gone up my back and my shoulder.
Okay.
A spasm. And
It's a spasm. Is that what it feels like, a spasm? Yeah.
I think she was in a bit of a state, to be fair. With the
She was
pain.
quite panicked.
Yeah, she was quite panicked. And she didn't look very well when we went in. I thought she looked quite pale and quite distressed.
Okay. How old are you?
71.
Oh, just a bairn. You maybe didn't feel like it. It's this side that's sore, isn't it?
I feel like it.
Listen, so I'm going to try and get your blood pressure on that side. Are you able to sit back on your hip? Okay, hon, that's it. Just try and relax. You've done fine.
Have you been like this for 2 days?
No. When did it start?
Now it's off. An
When
hour
it
or so.
started like a spasm. Were you actually doing anything when it got worse?
I was in bed
Right, lying in bed.
because it was painful
Okay.
to breathe.
Okay.
Oh, perfect. 36.8.
Okay, so you want to score the pain out of 10, 10 being the worst that could possibly be.
10 it was.
Okay, so we'll say it's right up to 10. It's a 10 just now. And it's around the back of your ribs.
Went up the back.
Okay.
And my shoulder, up
Right,
my
okay,
neck.
okay. And you're feeling it in your neck up
I
here.
couldn't move that a wee while ago.
Right, okay.
It was so painful.
Tell me how you fell again.
Are you sure you want to know?
Aye.
Oh, to the grandchildren. It's a place
Oh, yeah, the trampoline place. Yeah, I know what you're talking about.
I jumped from the smallest bit onto the airbed
Okay.
and I hurt myself.
Yeah, it's slightly unusual for a 71-year-old to be injured in a trampoline accident, I guess.
It was certainly my first patient, was 71 on a trampoline.
Did you bounce onto like a big inflatable?
Yeah.
Yeah, okay. And so then you landed on an inflatable. Was that when you hurt yourself?
I just felt everything jarring.
Yeah.
I was just falling on a trampoline on her side, then she'd have a rib injury. And often rib injuries are not very serious. They're very painful, but not very serious. You know, the hurt's worse than the harm, if you know what I mean by that.
Rib injuries can often cause shallow or laboured breathing. Every breath can hurt.
Are you able to sit forward at all? But even just slightly forward would be helpful. Okay.
Yes.
Nice deep breath.
I can't.
You can't? Okay, just breathe normally. Well, do your best. Good, that's you. So you're still getting good air entry into both your lungs, that's a good sign.
You see anything there? You see any bruising or anything like that?
Okay. I can't see any obvious bruising, but I'll have a wee feel, okay?
No bruising. But it's underneath my breast.
Nothing sore down here?
No.
Nothing in your hip at all?
Hips are sore anyway.
Sore here?
And then around the back?
Around here? Can you move your arm at all? Are you able to lift your arm up?
I'm trying.
Sore when you do that? Okay, just relax then. Any pain here?
Yes.
Yeah. Is it going to the front?
No, just back. And neck.
Okay.
Lots of time people in pain will attempt to stop moving to reduce the pain that they're in, so they'll guard an injury by, immobilising it. So it wasn't overly concerning for us that Hazel was struggling to move a little bit. Often once we get people moving, then you find that they actually can move a little bit more than they first think they can.
Just keep that breathing nice and relaxed if you can, Hazel. It's helping a little bit. I know you're doing really well. But just keep going like that. It says, obviously, if you're pain when you're breathing, it's going to make it worse the harder you breathe.
So take me casualty. The light will cause it.
All right, okay. If you didn't want to go to the A&E department, that'll narrow our options quite significantly, but we'll talk about that in a minute.
Oh, I don't want to end up in hospital. Leave my guts. Can't leave my guts.
I mean, if you can't get yourself up off the chair, by yourself, and you live alone, I mean, the easiest option would be to give you some pain relief.
She was in a lot of pain, she was struggling to move, and I think she sort of listened to us and agreed that, yeah, this is a wee bit too sore and needs to be looked at further.
I've got gas in air, which is something you soak in, but you can't take that if you've got potential chest injuries because it can make it worse. So we're kind of limited. Some morphine to make you feel a little bit better, take you up to the hospital, get them to have a look at you.
Morphine is normally administered directly into a patient's vein via a device known as a cannula.
It depends on what somebody's veins are like. If you can see them, if they're palpable, which means if you can feel them, then they're easier to cannulate. Often the older people get, the more spidery their veins get, like spiders' legs, and they'll kink around and they'll go different ways.
Lost a vein. No, I'm sorry about that,
Sorry,
Hazel.
try another again.
I've missed it again. I can't find the vein. There's no vein in there.
Instead of giving her IV intravenously in her vein, we gave her an injection in the muscle.
Okay, intramuscular. I'm sure you've done this before. Intramuscular.
Yes.
It takes a bit longer to work because the drug has to go into the bloodstream through a muscle as opposed to going directly into the bloodstream. And that did help.
So the next part of the plan, Hazel, is how we're going to get you down the stairs.
One at a time.
Absolutely. If you think you could walk, we could put you in a chair, but I don't think it's going to help you.
Yeah, one at a time.
Bumping you down the stairs in a chair. Okay, you've got your phone, eh? So you can phone around and tell people what's going on.
Have I got my phone?
Right, 1, 2, 3, well done. And we'll just get you sitting in that chair.
I should have known better.
Right, we'll get a bit of fresh air in here, Hazel, because
Yes.
it's such a beautiful day outside. You going to manage a couple of steps down? Is that going to be too much for you when your arm comes down? We'll see. Keep going. Yeah, you're almost there.
Almost,
You did it.
that's it.
Better.
Excellent. Thank you.
Cool. Come on then, let's go and see what we can see.
Josh and Lisa are the backup crew treating 71-year-old Liz, who is having difficulty breathing.
You squeeze my hand for me, Liz. That's it, well done.
Just throw it over.
That's it. You're in good hands, okay, doc? It's okay.
And split it in
The
half.
team must get her to A&E urgently.
You're gonna feel a wee cold board going underneath you, but it's just to get you outside, my dear, okay? We were in quite a confined space in the bedroom. It was quite difficult to get her out with a scoop stretcher. Sorry, my dear. Could get her up onto the bed at least. That'll be a half a journey.
You okay, Josh?
We can just get her up onto the bed and then that'll be a start.
Are you able to slide up your wee Phil?
Certainly. Ready, set, lift.
Well done. That's it, Liz. Nice
All right,
and
my dear.
relaxed for us.
Try and keep that handy in for me, look.
That's it, Liz. You're doing really well.
Right, my dear, out you on the board nice and secure, okay? Right.
You okay there?
Yep. A little bit of a tight squeeze.
Yeah. That's it, Liz. We're just getting you under the bed, okay? You're very welcome.
Getting a verbal response now, so it's good.
Yeah, verbal response.
Yeah. All right, my dear. I think it maybe took us about 20 minutes to get her extricated. And within that 20 minutes and the treatments that we had started, that Liz started to come back round, that her GCS started to increase, that she was more with it. That's it. We're outside your house now, my dear. Keep your eyes open for us.
That's it, Liz. Well done.
Put us way back on your mask. Okay, my dear. We're going to get you into the ambulance, okay? Okay? Where's the pulse at?
Liz, nice and relaxed.
All right, my dear. Let's get you in, okay?
I'll be all right.
Now we're going to have a wee bump here, my dear. You're welcome, Liz. And a bump till we get you up here, okay? Although slightly confused, she was certainly much, much better than she was in the house.
You okay, Liz? Yeah.
Well done, you.
That's it. Well done. You're doing brilliant. Huh? I'm Colleen and this is Josh, okay?
You're in the ambulance, my dear, okay?
That's right.
You're in the ambulance.
I would say take her off and get her.
The crew prepares some final checks before Liz heads to hospital.
Is it okay if Josh has a listen to your chest again? Thank you.
No bother. Eh, no bother. Right, my dear, you just breathe away normally, okay? I've had tight. Very constricted. Very, very constricted. Is there asthma as well, or is it just COPD?
Total COPD.
Has she got ipratropium in?
No, yeah, we'll do
No.
5 and then we'll do an ipratropium.
Huh?
Yeah.
You're just tired.
No.
You're very welcome. There's no need to thank us. We're just glad that you're all right and we can see you. Been struggling a while? Huh? Been struggling a wee while, You're still inside the house, aye. So, Liz, you stop speaking and just try and relax for us, okay? Because if you're tired, that's just got to mark up wash. Just got to get some seatbelts on, Liz. Yeah. And then Marcel and Francis, we're going to get you to hospital, okay?
As the backup crew, Josh and Lisa's job here is done.
Thank you. Right.
Okay. Happy?
Yes, of course, thank you.
No worries.
You're a lot better from the first, didn't you?
In Liz's case, she improved with us. So when you walk in and somebody's unconscious, but by the time you're sending them off to hospital, she's up, she's talking to you, she seems much more comfortable. For us, you know, it's really positive to see that.
All right, Liz, my dear, you take care. Okay.
Thank you very much.
You're very welcome. She obviously needs to go to the hospital for the continuation of her care and definitive care, but we've managed to play a small part in making her a bit more comfortable. You do feel as if you've done some good work there.
It was hard work.
Well done, you.
In Liz's case, where we really did make that difference to her, treatments that we gave her, it saved her life essentially. You know, there's no two ways about it. That if we hadn't got there when we did, and Colleen and our colleague hadn't got there when they had, that she wouldn't be here anymore.
Well done. Proud of you.
That is so lucky that she's phoned. It's an excellent feeling that, you know, and we're very privileged to be able to do that and give people that opportunity with the skills and the training that we've been through.